Welcome back to Sidelines TV. I'm here today at Green River Farm in Wellington, Florida with Dr. Tim Ober. Dr. Ober is the veterinarian for the show jumping team of the United States Equestrian Federation, and we're really glad we took some time with us. How are you?
Well, thank you.
Is there anything that kids at home or just regular people can learn from you that you use on such a top level in everyday maintenance of their horse?
Well, my first message would be just that a horse is a horse, and it's our responsibility as caretakers of horses to learn how to do that at the highest level that's within our reach. So education about your horse and about the best ways to care for your horse is an ongoing process, and that should be worked at diligently every day.
Great. Well, Dr. Ober has volunteered nicely to spend a little time with us for a little of that education, so let's give it a whirl.
So today we're going to talk a little bit about the process of rehabilitating the equine athlete after an injury. And I was asked to sort of go through the process and give an outline to how we approach it. I think always the first and most important step in approaching an injured horse and figuring out how we get them well is to have a diagnosis. And an accurate and specific diagnosis is an important first step in the process. You really can't go anywhere without that. For me, there's two aspects to the diagnosis, the diagnostic process, that are very important. One is having a clear understanding of the acute or current injury. And that might involve radiology, it might involve ultrasonography, and we'll certainly start with a good, thorough physical exam. The second aspect of the diagnosis, and this is the really important part beyond recognizing the first stage, is a thorough understanding of the horse and the problems that the horse has underlying the obvious, that are maybe the root problems that led to the overload or imbalance that led to the injury in the first place. So that diagnostic process really has two phases. First, the current or acute injury, and two, understanding the root underlying problems. The second phase that we then get into is choosing a regenerative therapy. That would be a treatment that's designed to help optimize healing of the injured area. In these days, there's many options available. There's always the push to use a regenerative therapy right from the beginning, and that comes from pressure of clients always wanting to do the best that they can for their horse. I think it's important to begin that conversation with the recognition that horses will heal, and injuries will heal if they're managed properly, even sometimes in the absence of us employing the use of an expensive regenerative therapy in the process. So I want to keep that in the back of our mind as we go forward with the discussion. But the regenerative therapies that we use specifically include PRP, stem cells, the regenerative laser therapy, which is a new technology available to us, shockwave therapy, which has been around for some time now and definitely has some benefit in terms of stimulating healing in the early phases of an injury, and Iwrap is another example. There are others, but that would be the group of regenerative therapies that we rely on most commonly in our practice and in our approach. PRP stands for platelet-rich plasma. That means we collect the plasma from the horse, we actually separate the red blood cells, and concentrate the platelets in the volume of plasma that we collect, and inject that into a lesion. That can help stimulate pro-healing cytokines, which are signals that the cells produce to help stimulate healing. That's sort of the short description of how platelet-rich plasma works. That leads to hopefully a matrix or a structure or a foundation upon which healing can occur in an optimal way. Stem cells are another category altogether, really, that can be harvested and derived in many different ways. And really, we're in 2014, we're still in the early stages of learning what the best ways available to us are to harvest stem cells, store stem cells, and then use stem cells. So they may be fat-derived, they may be blood-derived, they may be embryo-derived, they may be umbilical-derived. So there's many different sources of stem cells available to us. We inject these stem cells into the lesion, often in conjunction with PRP or after PRP, in order to help build on the healing process, giving the area the actual cells that will form the basis for healing going forward. There's more to that entire discussion, of course, but that's a simplified version of the description. Iwrap is actually a long name for a very specific protein that's produced normally in our body anyway. And that protein is a potent anti-inflammatory protein. We make Iwrap from serum, not from plasma, which is a small distinction, but regardless, it still comes from the horse. And we condition that serum to amplify the production of this Iwrap anti-inflammatory protein. Traditionally, we use Iwrap more commonly in joints than in soft tissue injuries. And really the reason for that is the basis of the initial research with Iwrap focused on joint therapy. So Iwrap is under the category as well of regenerative medicine, but our focus of the use of Iwrap tends to be on joints.